Good morning. Welcome to today's press conference on Howard County's COVID-19 response. Thank you to those who are joining on Facebook Live. My name is Angela Cabellin, and I am the Deputy Chief Administrative Officer. Today, we are joined by the following Howard County leaders: County Executive Calvin Ball, Howard County Health Officer Dr. Maura Rossman, Raul Delerme, Director of Recreation and Parks, Fire Chief Bill Anashevsky, Police Chief Lisa Myers, Mike Hinson, Director of Office of Emergency Management, and Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital. We will hear from each of them and then open it up to questions from the press. And now to hear from County Executive Calvin Ball.
Thank you so much, Angela. Yesterday, we passed the unfortunate milestone of 8 months to the day since our first confirmed case of COVID-19. Within hours that March day of learning of that initial confirmed case, Howard County was one of the first jurisdictions in the state to take bold actions, including closing our mall in Columbia, movie theaters, and the shops at Savage Mill. Since the spring, we have been in a state of emergency and quickly stood up testing sites around Howard County, worked with our hospital to be prepared for potential surges, and pushed for more data resources for this anticipated fall increase. One of our top goals was to surpass 6,500 administered tests per week. We have exceeded that goal for 18 consecutive weeks. And last week, more than 10,000 tests were administered. To date, we have administered more than 204,000 tests, which equates to more than 35% of our population being tested. We have also surpassed our PPE goal of a 30-day supply, and we are now aspiring for a 90-day supply to get us through this winter. Howard County has led the state on issuing holiday guidance aligned with CDC best practices for both Halloween and Thanksgiving, and promoting celebrations in our community that help keep our residents safe. We've communicated aggressively on the necessity of mask wearing and adherence to the governor's statewide mask wearing order. Many of our county buildings have remained closed to the public, and our county employees have been able to still provide excellent service to our residents and businesses online, as a third of our workforce is teleworking. Since March, county employee out-of-state travel has been canceled, and staff that still report to offices are staggered and required to wear masks throughout buildings. Throughout this year, we've seen a majority of our residents, businesses, and employers work diligently to keep each other safe and follow our guidance. However, we've all grown tired from the inability to see our loved ones. I, for one, have missed not being able to hug my parents for 8 months. And we all feel that frustration, so many people are beginning to take fewer precautions than they did previously. The significant lack of a unified national strategy has also made it more difficult to combat the spread, and, as expected, the cooler weather with more people congregating indoors has brought a fierce surge of cases. To date, we have 6,758 confirmed cases of COVID-19, 3,271 total recoveries, and unfortunately, 139 of our neighbors who have succumbed to the illness. Just last week, 472 Howard County residents tested positive for COVID-19. And yesterday, Howard County reported 19 cases per 100,000 people. The threshold of 20 cases per 100,000 indicates uncontrolled community spread. This weekend, our positivity rate also reached 5%, another indicator that we are now at a tipping point. Both of these metrics were thresholds that triggered us to begin reinstating restrictions. And with that said, we are also among the lower third of Maryland jurisdictions in positivity rates, with 17 counties reporting positivity rates of more than 5% up to 14%. All but one of our bordering jurisdictions are also reporting a positivity rate above 5%. And when COVID-19 becomes this widespread, it makes it very difficult for contact tracing to be effective in identifying and isolating outbreaks. And as we know, this virus does not respect our county or our state borders. As we approach Thanksgiving and our winter holidays, it is vital that we act swiftly and thoughtfully to stop this spike in cases, keep our residents safe and well, and continue to support our business community. Our contact tracing efforts show that a majority of transmission of the COVID-19 virus has been from close relatives, family, and friends. It is clear that with the onset of cooler weather, larger gatherings of families and friends, especially indoors, have fueled the current spike we're now seeing. So today, I'm announcing new advisories that limit indoor gatherings to no more than 10 people and outdoor gatherings to no more than 25 people. Now, social gatherings will include family gatherings, parties, cookouts, parades, festivals, conventions, fundraisers, amateur sporting events, and other gatherings not already associated with operating or patronizing a business that sells merchandise. Our Recreation and Parks has canceled all tournaments that include out-of-state participants and redoubled its enforcement of mask wearing for all other programs, leagues, and tournaments. I'm also announcing our Stay COVID Safe communications campaign for Howard County to inform and remind the public on simple steps everyone can take to stop the spread of this virus. We believe that consistent, persistent, and pervasive messaging is needed to break through the COVID fatigue we're all experiencing. To stay COVID safe, we will create a team of ambassadors to engage our residents throughout our communities, encourage people to wear masks, and to avoid hosting or attending large gatherings. We will also be utilizing partnerships within our community with our businesses, libraries, restaurants, and more to ensure that everyone has the resources and knowledge to stay COVID safe. We've done it before, and we will crush this curve again. But we must do everything that we can. None of us want to roll back reopenings or to see more restrictions at the state level. But if our numbers continue escalating in the wrong direction, all of that is possible. We must continue wearing masks to slow the rapid spread we're seeing. I know we've all grown weary of this pandemic, and it's frustrating and it's emotionally exhausting. It's kept us away from the people we love, and it's also unfortunately not going away anytime soon. With colder weather, viruses like COVID-19 and the flu are more likely to hang in the air, And with this upcoming holiday, we're at a pivotal point. And the decisions that we make and how we choose to celebrate will impact the spread of COVID-19 throughout the rest of this winter. Traditional large family gatherings from numerous households are fun but can increase the chances of getting or spreading COVID-19 or the flu. We remain data informed and people driven and are committed to slowing the spread of this virus. Over the next 6 weeks, we as a community have an opportunity to once again slow the spread of COVID-19. The actions we take, wearing a mask, physically distance, washing our hands, will save lives. Thank you.
Thank you, Dr. Ball. And now we'll hear from our Howard County Health Officer, Dr. Maura Rossman.
Good morning. As the county executive outlined, Howard County's COVID metrics continue to rise to the point where it has become necessary to adjust our daily lives to stop the rise in cases and deaths. We must remember that each case and each death is one of our Howard County neighbors, not a mere number on a dashboard. We knew that this fight against COVID would be a marathon and not a sprint. We know that people are weary of masks, physical distancing, and maintaining a COVID bubble. However, now is not the time to relax. We must all work together to improve our numbers and flatten or crush this upward curve. The key preventative measures that we can follow are very simple, and we know them well. Wear a mask and facial covering. We know that it not only protects others, but data shows that it protects you. Maintain a distance of at least 6 feet from others when possible, when outside, when inside, outside of your home. Wash your hands frequently or use hand sanitizer. Stay home as much as possible or limit time spent in indoor public locations or with large groups outside. Clean and disinfect frequently touched surfaces. The holidays are almost here. Thanksgiving is a time many share with extended family and close friends. This year, more than others, we need to take care of each other by finding alternative ways to celebrate, so not to expose each other to the virus. Some ideas. Have a small traditional or maybe non-traditional dinner with only members of your household. Prepare traditional family recipes for family or neighbors, or try out a new recipe that maybe someone who usually came for Thanksgiving didn't like. If you know neighbors are not able to get out or loved ones, make them a special meal and leave it at their front door. Have a small outdoor get-together with your family in place of a holiday meal with physical distancing and mask wearing. Maybe enjoy apple picking or pumpkin picking if you haven't already done so. We also urge that you avoid indoor gatherings, dinners, and parties. It is at these gatherings with family and friends outside of the immediate household where precautions are not taken and the virus is often spread. Avoid large crowds. Shop online when possible. Get a flu shot if you haven't already done so. Stay home if possible. It's the best way to protect yourself. And avoid travel to attend holiday gatherings. While we wait for a vaccine, we must work together to protect each other and our families. As difficult as it seems to continue with virtual get-togethers and video chats and Zoom school, we must all remember that we are not alone in this challenge. We are all in this fight together, and together we will get through it. Thank you.
Thank you, Dr. Rossman. Now we'll hear from Raul Delerme, Director of Recreation and Parks.
Thank you, Angela. Since the beginning of this pandemic, and as we reopened our parks in May, our number one concern has been the health and safety of our recreation and parks patrons. As our parks, facilities, and programs remain open, I strongly encourage you to use personal responsibility and comply with the CDC, state, and county guidelines and protocols, especially by wearing a mask. With our parks and facilities being an outlet for people during this pandemic, I understand the mental and physical health benefits that exercise and being outdoors brings. Our department is doing everything we can to help keep this opportunity available for children and adults. We have placed over 500 signs throughout our parks informing users of safety protocols. Our park rangers continue to monitor our parks to ensure rules and regulations are followed. We are requiring face coverings while not exercising, conducting health checks, practicing rigorous cleaning practices, and more at our indoor facilities. Our department is not currently offering indoor basketball leagues and wrestling based on the CDC guidelines as well as the state guidelines. With the current rise in Maryland's COVID-19 cases, the Howard County Department of Recreation Parks offices will continue to remain closed to the public. In-person programs will continue to run with strict COVID-19 safety guidelines. We will continue to provide virtual programs. Our Rec Zone program will continue to operate with safety guidelines that provides child care services for parents who are back to work. The Robinson Nature Center, Historic Sites, Athletic Center, and 3 community centers, including a Roger Carter indoor pool, will remain open at reduced capacity. Those who rent our indoor facilities or pavilions must adhere to the new 10-person limit for gatherings. We are strictly enforcing a no spectator policy for indoor programs. We are allowing only 1 parent or guardian per player at outdoor games, leagues, and tournaments. We are not allowing out-of-state teams or individuals who do not live in Maryland to participate in our tournaments or games. A list of these rules for those playing on our Howard County fields are listed on our main page of our Recreation Parks website. Again, these protocols are in place for the safety of everybody in our parks and programs. Thank you.
Thank you, Director Delerme. And now we'll hear from Fire Chief Bill Anashevsky.
Thank you, Angela. Well, we've all heard it here today. We've been watching the positivity rate rise across the country, the state, and now our county. We are not immune. Our providers stand ready to continue providing high-quality service to Howard County. Fire and Rescue has implemented several programs in the spring response to include a Howard County General Emergency Room Liaison, ambulance decon team, rapid response teams for 911 persons under investigation for COVID-19, a mobile integrated community health program, and an incident support team for planning and logistics, all to assist in the response of the COVID-19 pandemic. Today, I am happy to report that we have been able to increase our personal protective equipment stockpile and currently meet the 90-day stock model. Through constant communication and partnership with County Administration, Howard County Health Department, Howard County General Hospital, the Maryland Institute for Emergency Medical Services Systems, and the Office of Emergency Management, we have been able to adjust our response protocols and provide the best care and options to our community. But we are not out of the woods. We need your help, the community, to maintain that service and for the protection of our responders. We all should do our part to reduce the potential for infection spread. And you've heard it already here today. Do not gather in large groups and maintain social distancing. Wash your hands routinely. Remember the 20-second rule. And wear your face covering. 3 things that we can easily do to reduce the positivity rate and keep Howard County the best place to live, work, and play. Thank you.
Thank you, Chief. And now, Police Chief Lisa Myers.
Good morning. 8 months ago, the county started to put into place rules and guidelines to keep our community safe. Little did we know where we would be today, with numbers once again on the rise. We all know about COVID fatigue, and it's real with each day, week, and month that goes past without normalcy. Here in Howard County, we have been proud of the way our community has met the challenges. Since the beginning of this pandemic, our residents and businesses have been overwhelmingly compliant with the restrictions put into place to protect the health and the safety of their family, friends, and customers. As your law enforcement agency, we are happy to report that we have not had to issue citations for noncompliance. People have willingly modified their behaviors when reminded of the rules or educated about the requirements. From the beginning, our officers knew that any enforcement action would be a last resort. Voluntary compliance is always the goal. Here, many months later, in even more challenging times, when case numbers are rising, along with positivity rates, and we are heading into the holidays, we realize we must be safe. I know it will be hard for me not to gather with my family for Thanksgiving, and I'm sure it will be no different for each of you. But we are asking you to hold on, to stick with us in our effort to get this under control. With these new requirements, our goals are still the same. We'll be asking you for your voluntary compliance. Issuing citations will be our absolute last resort. We will do it if we must, under the direction of the governor and the county executive, but we have every reason to believe that you will continue to be our partners in this effort. It's hard for all of us. There is no reason to make it even harder on one another. Let's do the tough work now, make the difficult sacrifices for our families, neighbors, school kids, businesses, and our entire community. Thank you.
Thank you, Police Chief Myers. Now, Director Mike Hinson from the Office of Emergency Management.
Thank you, Angela. We in the Office of Emergency Management knew very early in this event that supply chain disruptions we were facing with personal protective equipment were going to negatively impact the entire country, the state, and obviously Howard County. While supply chains are not back to normal, they have improved, and Howard County has been addressing inventory needs for months now. We are in a much better position than we were when COVID-19 began. As the executive stated, we're now trying to meet a 90-day goal. And as the chief stated, he's already gotten there. We have multiple other departments that have gotten there as well. So that's a goal we'll hope to meet soon. We continue to work with vendors and companies both locally and within the state to improve the resilience of that supply chain. All that being said, the best way to reduce strain on the supply chain is to mitigate the spread of COVID-19. With that in mind, the most impactful thing people can do in the community is to remain focused on wearing a mask, remaining physically distant from others, and abiding by the group size guidance. In the coming weeks, members of the Office of Emergency Management will be making our way to areas where people are known to gather and areas with higher case rates. We will provide guidance and refresh materials on these protective measures as a way to remind people that we all need to combat COVID fatigue. We will also continue working with our community organizations active in disaster, or COAD. To date, they have already helped make, and distributed thousands of masks to those in need in our community. They have run many pop-up pantries as well, and they will now assist us with this outreach campaign in order to curtail COVID fatigue. We have all been through this arduous event together, but it isn't over yet. We will need to stay focused on protective measures and work as a community to keep each other safe. Thank you.
Thank you, Director Hinson. And finally, Dr. Shafiq Ahmed, Interim President from the Howard County General Hospital.
Good morning. As reported by the other entities here, Howard County General Hospital has been seeing an increase in our COVID-19 patients. We haven't seen this level since the first surge, so we are feeling that we are in our second surge of patients. The increase has been rapid, as described here, and we all understand the method of spread. Over the summer, we have been planning continually for the second surge and are prepared to meet the increased demand. Our staff and facility will flex according to the needs of the community. We are taking all recommended safety precautions to keep our patients and our staff safe. At this point, we are still performing the same essential care in our emergency department and doing elective and emergency surgeries. I want to urge that we can manage all of these conditions safely, and I would encourage people not to delay their care that is necessary. We are continuing to coordinate with our health system, the Johns Hopkins Health System, and all county and state entities to manage the pandemic response. As mentioned before, this is a community effort, so I implore all of my fellow citizens in Maryland and Howard County to continue to follow the precautions that are laid out here. This is the only way that we can fight this together, and we will be there and ready to take care of you if you do need it. Thank you.
Thank you, Dr. Ahmed. Before we take questions, I just want to say to those who approach the podium, please repeat the question for the sake of those who are tuning in on Facebook Live. And now we'll take questions from the press.
Are there any
Jeff.
particular hotspots identified geographically in the county, whether it's people where there's a lot of multifamily living? You tell me. I mean, what are we seeing as far as hotspots?
What are the hot spots? Dr. Rossman?
The question was, are we seeing any hot spots in Howard County, geographic areas or high density living arrangements? I would say right now in the past 2 weeks, we're seeing increased spread within households throughout Howard County. It was mentioned that this virus knows no boundaries and it knows no zip codes. What it does know is people, cool weather, low humidity, not wearing a face mask, and not physically distancing.
I have a question.
Next question.
Yeah, I'm not sure who to address this to, but I heard you say that you'll have ambassadors going out, and then I heard you say members of the emergency management. So can you kind of distill that for us? Are you going to have like a task force that's going to go around and I guess not hand out citations, but tell people to break it up, or you're not wearing a mask, or can you give us more than just ambassadors, or what's the plan for this?
Sure, thank you for that question. The question is, please tell us more about our ambassadors. I'll have Director Hinson first chime in on that.
Is that the enforcement plan, I guess?
No, that is not an enforcement task force or anything of that nature. It is literally to get the word out there and to really fight COVID fatigue. Everybody's been in this for months now, and we just need to continue to get new messages, different messaging out there that's still hitting the same goal and the same points, but we need to find a new way to communicate it as a way to really just mitigate people having that COVID fatigue, not taking that second to get the face mask on, wearing it incorrectly, not remaining physically distant. All these things that are very important. We just want to really get the word back out there. We're going into, the cold season here, and we just want to make sure that people are getting that message in their head, new and different ways, and they continue to do that for the safety of everyone around them and themselves.
So I guess the follow-up, is there an enforcement arm of this? And what should someone do if they see a group that's gathered, that they want, they want to report or have it broken up? Do they call the police?
The question is, can you talk a little bit more about our enforcement approach as a county? And first, we'll have Chief Myers.
Certainly, if a citizen sees a violation, they can contact the police and we'll respond. We've been very fortunate, as I said earlier, in this county, that our citizens have been compliant. Our goal is to seek compliance first before we would issue any citations, and we have every reason to believe that our community will work with us.
And also Dr. Rossman from the Health Department to also speak to that.
Since the beginning of the pandemic, the health department, along with our local police and state police, have been responding to complaints from our residents in regard to safe business practices and restaurants. The public can continue to call the health department if they are seeing non-compliance within the business community and restaurants. We go out and investigate each and every complaint. We too have not had to issue a citation because the businesses have come into compliance. And if I recall correctly, we probably had 2 businesses where we had to do several warnings, but they fell into compliance. So we hope that continues.
Thank you, Dr. Rossman. Next question.
We're seeing mask orders being implemented in other counties and jurisdictions that are stricter than what the state has been put in place. Is that something that Howard County is looking at as well? And then also, what are the metrics that would take us to the next step? These restrictions, again, aren't as strict as other counties in the state right now. So what threshold are we looking at for the next rollout?
Thank you. The question is, comment on whether Howard County would consider more strict mask restrictions. And can you repeat the second part?
Just the next threshold.
Next threshold of metrics.
So as always, we will in Howard County take whatever action is necessary to keep people safe. I think in concert with the governor's mask order, we have had a rigorous communication campaign, and I think that our ambassadors will help remind people. For the most part, many in Howard County are following the rules. I think they just need to continue sometimes to be reminded, and there's always an education piece. As to the thresholds, we continuously monitor the data and continue to work with the governor's office and other county executives and the mayor across Maryland. And I think that we will be working with many of the partners from whom you heard today to evaluate data constantly and make changes as needed.
I just have
Yes.
one last question for Raul.
Okay. This is for, okay, go ahead.
You mentioned the facilities like Roger Carter would be operating at reduced capacity. Do you mean further reduced from the current capacity? And what do residents do if, say, they signed up for a virtual class or an in-person class 2 weeks ago, and now they see the numbers spiking and want to cancel? Is that something that will be allowed given COVID?
Okay. So Director Raul Delerme is going to comment on Recreation and Parks approach and further talk about what the restrictions are in place for clarification.
Now, that was a long question, so I think she kind of hit it. In regards to if you want to cancel an event or program, yes, we will offer a refund for that. In regards to capacity, we are in our facilities are at a 50% capacity. Usually those numbers are way below the requirement for indoor gatherings. Usually our programs are spread out. We can control our programs easier than we can a gathering like a birthday party as such. So.
So it won't be further limited on capacity.
Correct.
Because you already have it so.
Correct.
Okay, thank you. Thanks.
Thank you for that, Raul. Go ahead.
initially, the county, when we had the first spike, delayed the start of the 5-cent bag fee because the numbers were so high and they didn't want to promote reusable bags. It's since been enacted. Has anyone looked at whether that's a potential health hazard or whether that should be put on delay for now until the numbers come down?
This is a question regarding the 5-cent bag fee and whether there's any consideration or evidence regarding the spread of COVID through bags. So,
So the county council enacted the bag fee, and as you indicated, it has already been enacted, and it's already been implemented. People are using it. According to most of the research and data, their chances of getting COVID-19 are infinitesimal when it comes to people bringing their own bags in. And I think, frankly, people are just beginning to get into a rhythm and understanding that council implemented fee.
any last questions? Okay, thank you very much for joining us. This concludes our press conference for today.